Hello everyone, myself Jamika, and today we are going to discuss about mania. What is mania? So the definition of mania. Mania refers to a syndrome in which the central feature are overactivity, mood changes, which may be towards elation or irritability and self-important ideas. The lifetime risk of manic episode is about 0.81%. This disorder occurs in episodes lasting usually 3 to 4 months, followed by complete recovery. So, what is mania? Mania is nothing but extremely elevated and excitable mood, which is usually associated with bipolar disorder. Person may feel extremely elevated, hyperactive in nature. Next, we are going to see a classification of mania according to ICD-10. F30 is manic episode, F30.0 is hypomanic, F30.1 is mania with psychotic symptoms. Psychotic symptoms include delusions, hallucination, talking incoherently, and agitation. F30.2 is mania with psychotic symptoms. F30.8 are the manic episodes. F30.9 is manic episode unspecified. Now we are going to see what is hypomania. Hypomania is lesser degree of mania. Mild elevation of mood is there, increased sense of psychological well-being and happiness, not keeping with ongoing events. They will feel positive, they will be happy, but it is not related to ongoing events. No impairment in social or occupational functioning or to necessitate hospitalization. There is no need to hospitalize a person who is suffering with hypomania. No psychotic symptoms in hypomania. There will not be any delusion or hallucination or agitation. Next, we are going to see etiological factor. First one is neurotransmitter and structure hypothesis, which means brain changes. In brain chemical, what are the changes will be there? Genetic consideration and psychodynamic theory. First, we are going to see about neurotransmitter and structure hypothesis. In that, excessive level of norepinephrine and dopamine will be there, an imbalance between cholinergic and non-adrenergic system. Then, deficiency in serotonin. Lesions are more common in this population in the area of brain. So in short, this is hormonal imbalance in the brain. Next, genetic consideration. Monozygotic twins have higher rate of incidence than normal siblings. What is monozygotic? To whom we call a monozygotic twins? It is from single womb and it's identical. First degree relatives, 5 to 10% chances. Identical twin with bipolar disorder have 40 to 70% of chance. Next, psychodynamic theories. Faulty family dynamics during early life. Manic episode as a defense against or denial of depression. Patient may perform hyperactivity to defense against denial of depression. Clinical features. Elevated mood. In elevated mood, you will feel an extreme, unrealistic feeling of physical and emotional well-being. You will feel high and increased in quantity and speech of physical and mental activity. Your mental activity will be increased, your physical activity will be increased, you will be jumping, you will be shouting. There are 4 stages of elevated mood. First is euphoria, elation, excitation, and ecstasy. So euphoria, what is euphoria? It is increased sense of psychological well-being and happiness not in keeping with ongoing events. Elation, moderate elevation of mood with increased psychomotor activity. Intense elation of mood with delusions of grandeur. What is the delusion of grandeur? Person may feel they have supernatural power, they are celebrity, they are famous. So that is delusion of grandeur. Ecstasy, severe elevation of mood, intense sense of rapture or blissfulness seen in delirious or stuporious mania. Next, we are going to see the effective symptoms of mania. Elevated mood, expansiveness will be there, humorous, inflated self-esteem, intolerance of criticism, lack of shame or guilt. Sometimes irritable mood is predominant, may shift from euphoria to depression or anger. Behavioral symptoms, how the behavior changes of manic patients: aggressiveness, grandiose act, hyperactivity, increased psychomotor activity, irresponsibility, they will be not responsible for anything they do, irritability, argumentiveness, poor personal grooming, provocativeness, increased social activity, dressed up in beauty or flamboyant clothes, sexual hyperactivity. So these are the behavioral symptoms. Next, we are going to see the cognitive symptoms: ambitiousness, denial of realistic danger, easily distracted, flight of ideas, use playful languages, speaks loudly, delusion of grandeur, delusion of persecution, lack of judgment, distractibility. Now we are going to see psychological symptoms: dehydration, inadequate nutrition, little need of sleep, and weight loss. These are the physiological symptoms. Diagnosis, how we can find out that person is suffering from mania. So first one is according to ICD-10 diagnostic criteria, then psychological test as young mania rating scale, then next is mental status examination based on signs and symptoms. Now mental status examination. There are 5 components of mental status examination: general appearance and behavior, mood and affect, thought process and content, sensorium and intellectual process, judgment and insight. So first we are going to see general appearance and behavior. What are the changes in appearance and behavior will be there of manic patient or manic person? Psychomotor, agitation, sitting still is difficult, they will not be able to sit at one place. May wear clothes that reflect elevated mood, they will be wearing bright clothes, flamboyant and attention-getting clothes, shiny clothes, pressured speech, interrupts and cannot listen to others. They will be interrupting in conversation. They will not be, they cannot be sit quiet. They will be interrupting while talking. Next, mood and affect, euphoric, grandiosity and false sense of well-being. Mood is quite liable. Next, we are going to see thought process and content. Flight of ideas will be there. Cannot connect concept and jump from one subject to another. They will not be sticking to one concept. They will be jumping from one to another and another to another. Circumstantiality and tangentiality. Do not consider risk or personal experience, abilities or resources. Some experience psychotic features like grandeur of delusions. Next, we are going to see about sensorium and intellectual process, oriented to person and place, but not to time or rarely to time. Intellectual function is difficult to assess during the manic phase. Claims to have many abilities that they do not possess. They will be saying, I am having this ability, I am having that ability, which they actually don't have in reality. impaired ability to concentrate or pay attention. And if there are psychotic symptoms, we may experience hallucination. Next, judgment and insight. Easily angered and irritated, impulsive, rarely think before acting or speaking. They just speak, they don't think whether what they are speaking, what they are talking, how they are acting. Insight is limited. Believe they are fine and they do not have any problem. And they always blame other person for their difficulties. So this was about mental status examination. We have seen general appearance and behavior, mood and affect, thought process and content, sensorium and intellectual process, and judgment and insight. Next we are going to see self-concept. Exaggerated self-esteem, believes they can accomplish anything, a false sense of well-being. Next, roles and relationships. Rarely can fulfill roles and responsibilities, have trouble at work or school, too distracted and hyperactive to pay attention to children. Begins many tasks or projects but completes very few. Because they are irresponsible, because they do not concentrate and they are hyperactive, they don't have proper roles and relationships with their work or at their school or with their family members. And if they start working on something, they will not be able to complete that work as well. So this was about roles and the relationships. Next we are going to see physiologic and self-care considerations. Can go days without sleep or food and not even realize they are hungry or tired. They will not be able to sleep, or they will not have food, and they don't even realize that they are not eating or they are not sleeping. Unwilling to stop or unable to rest or sleep, ignores personal hygiene, destroy valuable items. Many physically injured themselves because of increased in hyperactivity, tend to ignore or be unaware of health needs. They will not be taking care of themselves. Next, treatment. We have three treatments: pharmacotherapy, electroconvulsive therapy, and psychological treatment. So in pharmacology, we are going to see the medication, and in psychological treatment, we are going to see therapies, family therapy. Psychopharmacology. So the lithium is a drug of choice, which we give for manic patient. 900 to 2100 mg per day. Carbamazepamine 600 to 1800 mg per day. Sodium valproate 600 to 2600 mg per day. Anticonvulsants. Clonazepam and valproic acid, calcium channel blocker, verapamil, antipsychotics, olanzapine, risperidone, quetiapine, chlorpromazine, and haloperidol, sedatives or hypnotics, benzodiazepines. So these are the medications. ECT and psychosocial treatment. ECT. When we give ECT, so it is used for acute manic excitement if not adequately responding to antipsychotics and lithium. If person is not responding or they are not getting a better result from antipsychotics or lithium, so by the time we used to administer electroconvulsive therapy. And psychosocial treatment is family therapy and marital therapy. Why we use? Because to decrease the interpersonal difficulties, and if they have any stress, so we can reduce by that, and to ensure that continuity of treatment or adequate drug compliances. Next, we are going to see the nursing management. We need to assess severity of disorder, whether it is mild, moderate or severe, knowing the cause, why, because of what cause or because of what etiological factor person is having mania, resources available, what are the resources are available, how we can take care of patient, judging the effect of patient's behavior on the people, and mental status examination. Next is nursing diagnosis. What are the nursing diagnoses? Risk for injury related to extreme hyperactivity. There is a risk of injury to themselves and to others also. Risk for violence related to manic excitement. Imbalanced nutrition less than body requirement related to refusal. They will not be taking proper food. Impaired social interaction related to egocentric behavior. So this is about nursing diagnosis. So here I am summarizing my topic, which is mania. We have discussed today about mania, the definition of mania we have seen, then we have seen classification, then we have seen hypomania, etiological factor we have seen, in etiological factor, concentration and psychodynamic theories we have seen. Then we have seen a clinical features. In that we have seen 4 stages of elevated mood, which is euphoria, elation, exaltation and ecstasy. Then we have seen affective disorder, behavioral symptoms, cognitive symptoms and psychological symptoms. Then we have discussed about diagnosis, diagnostic criteria of mania. Then we have discussed about mental status examination. In mental status examination we have discussed about general appearance and behavior of manic patient, mood and affect, thought process and content, sensorium and intellectual process, judgment and insight. Then we have discussed about self-concept, roles and relationships. Then physiological and self-care consideration. Then we have discussed about treatment, what are the treatments available for mania. Pharmacotherapy we have seen, in that medications we have seen, electroconvulsive therapy and psychological treatment. In that we have seen family therapy and marital therapy. Nursing management we have discussed, and at last we have seen nursing diagnosis. So here I am completing my topic mania. Thank you.